Hi, everybody. I hope you're having a great Monday. And I hope you got my messages about doing this Facebook Live today about breast augmentation. So, I'm Dr. Marissa Tenenbaum of West County Plastic Surgeons here at Washington University. And breast augmentation is one of the most common aesthetic procedures that women underwent in our country last year, and honestly, for many years prior to that. Breast augmentation is something that is generally done to enhance the volume and shape of the breast, and it can be done for a number of reasons, to add volume and to improve shape or improve fullness and change the proportions of where the breast holds volume. So, for example, sometimes the breast may hold more volume on the lower part of the breast, and we use breast augmentation to help change those dynamics. So, the most common way that we do breast augmentation is with breast implants. Um, we can also do breast augmentation with using your own fat and fat grafting, especially in combination with things like breast lift. However, that's a little much for this little segment today. So I'm going to talk to you today about breast implants. Um, I've done some of these educational segments in the past, and we've talked about the procedure and what to expect with recovery. Today, I want to focus a little bit more on the implants themselves. So, breast implants can be saline breast implants versus silicone gel breast implants. Saline breast implants are basically a silicone shell filled with saline or salt water. And the main benefit of saline is that when they rupture or deflate in the body, they deflate like a water balloon, and it's very obvious that the implant is deflated, and we don't need any imaging tools to tell us that the implant is not intact. As opposed to silicone gel implants, the silicone does not get absorbed by the body, so it doesn't deflate like a water balloon would. All of the gel typically is there, so we often will require imaging. I recommend an ultrasound to evaluate the implants at 3 years after surgery and then every 2 years after that. There are different types of silicone gel. So in our country, we are currently on what's called fifth generation silicone gel. So the technology of that gel has changed over the decades, and the current fifth generation gel is a more cohesive or solid silicone. You probably heard the term gummy bear breast implants, and that refers to the more solid or cohesive nature of the implant. But even within that definition of cohesive, there are different, what I would say, levels of how cohesive that gel is, ranging from kind of a softer solid, more like a jello, all the way up to a very firm solid, which really maintains shape. Two companies in our country, Allergan and Sientra, both have fifth generation gel, whereas Mentor does not have a true cohesive. They have a fourth generation gel, which is overfilled. So that implant, I have a sample of the Mentor implant here, an extra projection overfilled gel implant, but it is very, very soft to the touch and very nice for some women who want that more natural feel. Sientra has cohesive gel as well as a more cohesive gel. This happens to be their most cohesive gel, and you can kind of see if I turn it to the side here, that volume stays pretty distributed. It doesn't sink to the bottom of the implant. And so for some patients, that's really, really nice to help hold the upper pole of the breast and hold that tissue out. Allergan has a couple of different flavors, if you will, as well, ranging from a very soft but still cohesive gel. Sorry, that's not that one. That is this one. A soft but still very cohesive. You can see when I hold it on its side, it does kind of fall to the lower pole of the breast, but it feels very soft. And that one they call their responsive gel. This one is the next one up. It's called a soft touch implant. So it's more solid. You can see this is the exact same size and projection as that last one. When I hold it on its side, it maintains a little bit more in the upper pole. And then a fully cohesive, or what they call their cohesive, even though they're all cohesive gel, implant really holds that round upper pole. I would say, depending on your goals and your tissue, you can talk to your doctor about what implant might be best for you. I would say for me personally, the soft touch implant, which is kind of that in-between implant, is most commonly used by me. I think it has nice fullness and can maintain shape, but still feels really soft compared to the more cohesive implants. There are also teardrop shaped implants versus smooth shell implants. So I've also done some informational videos on breast implant associated anaplastic large cell lymphoma, or BIA ALCL, in the past. That's a whole different topic as well, which I'm not going to dive too deep in today. However, I think it's important to note that our current understanding of BIA ALCL is that most likely it is linked to texturing on an implant. So currently in my practice, I really only use smooth surface implants. I don't use textured implants. The downside to that is that unfortunately, teardrop shaped implants, or what we call anatomic shaped implants, they're all textured. And so I no longer use the teardrop or the anatomic implants and only use the smooth round implants. For many women, it may not make much of a difference, but there are some types of anatomy where I think that the teardrop implant was really, really helpful and really valuable, but we no longer use those. Now, the other thing I want to talk to you about is profile. So a lot of people probably have heard of profile of an implant, and different companies have different kind of names for their what they call the different profiles. Profile basically references, for the same width of an implant, how far does it project away from the chest wall. So for example, Allergan as an implant line in their smooth round silicone breast implants have several profiles, and they range from low profile, which is the absolute lowest profile, flattest if you will, low plus, moderate, full, and extra full. And this is important, again, depending on your anatomy, where you're starting, and what your ultimate goals are. Is your goal to have it be extremely natural, nobody's going to know, to maybe people are guessing a little bit more fullness, to more of an augmented look? That is going to be one of the factors in determining the projection. Because the most important measurement for your implant with your board certified plastic surgeon is going to be the width of your chest. You want to choose an implant that really fits the width of your chest. You don't want something that's too narrow or too wide. You want something that fits the width. And so once we have a range of what that width is going to be, then we can look at the different projections to determine the final volume that you're going to have added. And this is really important because choosing a plastic surgeon who is board certified and who does a lot of cosmetic breast surgery understands the ramifications of properly sizing implants. It has a lot to do with your body and your tissues, and then of course your goals. However, part of my job as your plastic surgeon is to help educate you about, based on your anatomy and looking at your goals, what I recommend. Sometimes I may recommend something slightly different from what you had in mind, and that may be because I think you'll have a better long-term result if we go in that direction, or I think it will fit you better or suit you better. And so that's really important to have those conversations with your board certified plastic surgeon. It's not as simple as saying, I just want to be a D cup or I want to be a C cup. Not as simple. So getting back to that profile, I might have to kind of turn my laptop here. I want you to see on my desk here, I have these different implants. Let's see if I can do this, sorry. So these 3 implants are the same base width, okay? The width of the implant is the same. This one is a moderate projection implant, and then we have a full projecting implant and an extra full projecting implant. So you can see that even though they're the same width, they are different volumes because this projects more, so it's got more volume coming in this direction, and this one even more in that direction. So that is kind of a visual representation of those. I would say for aesthetic breast surgery in my hands, the most common profile used is a moderate projection, followed by full and low plus, kind of in that middle range. Low profile implants we use more commonly in asymmetry cases where we're trying to match one side to another and we're looking for a very specialized implant. And then the extra full projecting implants, in my opinion, is a little too hard on most women's tissue. Sometimes when we're talking about breast reconstruction after mastectomy, we really need all of that projection. But in the vast majority of women undergoing augmentation, in my opinion, it's a little much to go that far. So usually kind of extending back down to the full projecting line or even the moderate, I think is going to have a much better long-term solution. And so this has been kind of a little quick tutorial on implants. I haven't really spoken to you much about the surgery itself. If anybody has any questions about that, I'm happy to do that. But I'm going to kind of continue to stick with just the implants for a little while. I wanted to talk about something that has gotten a lot more attention recently called breast implant illness, or BII. I get a lot of questions about this from patients who either are considering implants or who have implants. Breast implant illness is a description of a constellation of symptoms that some women can experience after having breast implants. As a physician and a scientist, to be completely honest, we don't really know yet how to determine whether or not a woman may or may not be more or less susceptible to experiencing symptoms after breast augmentation with implants or breast reconstruction with implants. Many of us in the community who are trying to study this more believe that it is very possible and very likely that this could be some kind of a low-level reaction to a foreign body. A breast implant is obviously a foreign body. Silicone is typically considered very inert, and you don't see a lot of biologic activity around a silicone implant, similar things like stainless steel. However, just the addition of something that is not biologic and it is foreign in some women probably can trigger some immune reactions and some inflammatory reactions. This might also be similar to something like a knee replacement or a hip replacement, which is again a foreign body. The types of symptoms that generally get reported most commonly would be things like fatigue, brain fog. Sometimes women report things like hair loss or skin changes, overall just not feeling like themselves. Unfortunately, a lot of these symptoms can be also similar to other illnesses or general aging or even things like menopause, and so that makes it even harder to really determine exactly what's going on. But there certainly are a subset of women who do not feel as good when they have breast implants in, and when you remove them, they feel better. However, in complete transparency, I will tell you that the vast majority of women with breast implants do well. They're happy with their implants. They're happy with their outcome. They're very active and healthy. And there certainly are also a subset of women who have some of these symptoms and they have breast implants and they get their breast implants, including often the capsule as well around the implant or the scar tissue that forms around a foreign body. They have all of that removed, but unfortunately, they don't feel any different or feel any better after their implants were removed. And that's where it gets really hard and tricky because unfortunately, some of these women are really suffering with a lot of symptoms, and removing the implants does not change that. So I personally have had some patients who have been very regretful about removing their implants because they liked them. They were just hoping they would feel better, and then they didn't. And so further studies really need to be done and are being done right now by members in my field and in my society on trying to determine and figure out what women may be more likely to experience these systemic symptoms with placement of a foreign body, and which women won't. Because if we could somehow really determine who's at more risk for that, it would help women really guide their decision about whether or not they want to consider implants in the first place. So I think that's really important, and I just wanted to address it. Again, it could be a whole different section all on its own, but since I was focusing on breast implants today, I wanted to bring that up. So again, lots of choices for implants. I think it's really, really important that your board-certified plastic surgeon is very facile with the different types of implants and understanding your anatomy along with your goals to help determine what's going to be best for you in the short term and in the long term. So, listen to your surgeon if they say, maybe this might be a better fit long term, it's going to age better, you're going to be back for fewer revision surgeries, etc., etc. Speaking of revision surgeries, so revisions are common with breast implant surgery. So I always tell my patients, no breast implant is a lifetime device. It is a man-made device, and it is unlikely going to last forever, okay? So in general, we tell them we're going to monitor it. I told you we're going to check every, 2 to 3 years to rule out or evaluate for any rupture. These really cohesive implants that I told you about, they're like a gummy bear. So if I cut them in half, they're solid on the inside. So a rupture is not like a water balloon that spills out. A rupture is going to be more like a tear or a fracture, which can still happen with these implants. If we know that that is happening, we definitely recommend that you have them replaced or at least removed, because that ruptured gel can trigger more scar tissue and more inflammation. So we do recommend you have it out. So other reasons you may come back for a revision surgery is going to be the implant itself, malposition of the implant. So sometimes you may undergo early revision because the placement of the implants is not perfect. Late malposition, so sometimes over time and aging, things can move and you may need that replaced. Aging of the actual breast tissue, so things like breast lifts, that sort of thing are also very commonly done, potentially with either removing implants or replacing implants at some point in your lifetime. The earlier you undergo breast augmentation with breast implants, the more likely you are to have more revisions, which just makes sense. If you start out at a very young age, possibly before you've had children, and then your body changes with weight fluctuations, pregnancy, breastfeeding, etc., you may possibly be more likely to have more revisions based on the changes of your breast. The implant may be the same, but the breast tissue around it may have changed in age. So that's really important to know as well. Breastfeeding. So breastfeeding after a standard breast augmentation, where we use an incision in the fold of the breast or underneath the breast, and we place the implant either behind the breast tissue or behind the muscle. In general, the vast majority of women can still breastfeed after that surgery. When we do procedures along with the augmentation, like breast lifts or breast reductions, that gets a little bit riskier in terms of potentially interfering with your ability to breastfeed in the future. So that's also important to know. But in general, breast augmentation is a very high satisfaction surgery. The vast majority of women are quite happy. The vast majority of women would do it again in terms of surveys. And there are, again, a subset of women who would not and who have issues. And this is just something to really talk to your plastic surgeon about. If anybody is interested in learning more, I'll be doing more videos. If you have ideas for topics, please send them to us. I'd love to do another video for you on combining implants with breast lift, as well as the actual procedure itself, where we can talk about recovery and expectations. So let me know, and thank you so much to all of you for tuning in, and share the video with your friends so they can see it. Okay, everybody, have a great Monday.